My name is Alexandria Cagle, and I'm doing a health assessment check-off for nursing 7102 and 59. First, we're going to scan the room. Okay. Now to begin, I've introduced myself to my patient, I've confirmed their identity, obtained consent, and performed hand hygiene. First, to begin the assessment, we're going to start with skin. We're going to look at color, temperature, moisture, texture, edema, skin turgor, any scars, lesions, or anything like that throughout the body. We're going to do it in the face, neck, posterior and anterior chest, and abdomen. First, I'm going to start with the head and the face. I'm going to look at size, symmetry, and position at Z midline. Next, I'm going to look at the scalp. I'm looking at hair distribution, color, any lesions, masses, tenderness, depressions, or infestations. Now we're going to look at the temporal arteries for tenderness. Now I'm going to do lymph nodes. Come towards me real quick. The preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Now we're going to palpate the TMJ. Turn towards me. We're looking for any subluxation, tenderness, or crepitus. And now we're going to test cranial nerve 5. I'm going to go here and I'm going to have you clench your jaw for me. And that's the muscular portion of that nerve. Now we're going to move on to sensory. If you can close your eyes and tell me where you feel me touch.
Forehead, left cheek, right cheek, chin.
Now we're going to do cranial nerve 7. I'm going to look at facial symmetry. Can you smile, frown, raise your eyebrows, puff your cheeks, and then pucker your lips out. Awesome, very good. Now we're going to go to the ears. I'm looking at ear shape, position, palpating the pinnae and the tragus. Using the otoscope, I'm going to look at the auditory canals. Both of those are clear, and we have pearly gray tympanic membranes. Now we're going to do cranial nerve 8, and I'm going to do the whisper test. Repeat after me. 1, 2, 3.
1, 2, 3. ABC.
Okay. And now we're going to do the Weber test for vitalization. Tell me if you can hear this. In the middle.
Yes.
Okay. And for the Rhine test, do you hear it better in position 1 or 2?
1.
I'm going to look at the eyes, the lashes, the brows, get a little closer and look at the conjunctiva. I'm looking for any abnormal discoloration, discharge, or lesions. We're going to look at cranial nerve 2, and we're going to do the Snellen chart. Ideally, we would be 10 feet away. I have the Snellen chart over here. I'm going to have you close your eye and look at that and read the lowest one that they would be able to, and that would be their vision.
LEFODPCT.
Okay. And then I want you to look at the wall behind me and let me know when you can see my fingers.
Yes.
Okay. And that's our peripherals. Now we're going to do cranial nerve 3. And I'm going to test your pupillary response. Okay. That eye is the direct response, and then the opposite eye is the consensual response. Now we're gonna do accommodation and convergence. I want you to look at my finger and follow it in for me, and then follow it out. There we go. Now we'll do cranial nerves 3, 4, and 6 for extraocular movement. You can follow my finger in the 6 cardinal directions. Very good. Now I'm going to look at your eyes with the ophthalmoscope. Thank you. We're going to look at the eyes, looking for the red reflex. And our structures inside the macula, retina, and blood vessels all look in good shape. Now I'm going to look at the nose. Looking at its position, it's midline and it's straight. Cranial nerve 1, we're going to look at smell. Close your eyes and tell me what this is.
Candle.
Very good. I'm going to look at nasal patency. If you can block one nostril and sniff. And now do the other side. Very good. Now we're going to look at the sinuses, and I'm going to palpate the frontal and the maxillary sinuses. Looking for any tenderness. Now we'll look at the throat and mouth, and I'll get a light. You can say "ah" for me. I'm looking at lips, gums, teeth, buccal mucosa. Make sure that everything is pink and intact. I'm also going to look at the tonsils if those are still present. Cranial nerves 9 and 10. I'm going to get you to open again and say "ah." The "ah." Okay. The soft palate and the uvula move symmetrically with phonation. And stick your tongue out for me and go straight. Okay, and go up and down. And that remains midline and symmetrical. Now I'm going to palpate your thyroid, your trachea, the carotid arteries. Okay. And then we're going to auscultate over the carotids, listening for groovies. So now we'll move on to the posterior chest. If you can spin around for me. So I'm going to inspect the skin again for everything that I mentioned earlier. I'm looking for signs of respiratory distress, any labored breathing, tachypnea, signs of cyanosis. Take some deep breaths for me. I see chest rising. Palpate for symmetrical expansion. Now I'll do a test for tactile firmness. You're going to say 99 when I touch.
99. 99.
Good. And we're going to percuss. Good. And now we'll auscultate over the posterior field. Deep breaths. Okay. Now I'm going to test for signs of consolidation. I need you to say E. This is going to be a gophony every time I move my stethoscope. Okay. And then now every time I move the stethoscope, I want you to say 99. And this is going to be bronchophony.
99.
Okay. And then now I want you to whisper 1, 2, 3, just the same.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. So now you can spin back around. So now we're going to look at the anterior chest, look at skin too. I'm looking to see chest rise, symmetrical expansion. We'll test for the tactile firmness again. Do the 99.
99.
Very Symmetrical expansion. We're gonna auscultate again. Very good. Now we're gonna go to the cardiac portion. Now we're gonna go and auscultate over the cardiac points. Got aortic, pulmonic, Erb's point, tricuspid, mitral, and I'm gonna listen at the apex of the heart and notate a regular rate and a regular rhythm. I would listen for 1 full minute. Now I'm gonna find and palpate the PMI. And I'm gonna get you to turn for me and lean back at kind of a 30-degree angle. So ideally here I'd have an exam table, but if you lean your head back, I'm looking for any signs of jugular vein distension here, which I do not see. Alright, while we're in this position in supine, I'm inspecting the chest for any heaves or lifts. I'm going to palpate the cardiac points, aortic, pulmonic, Erb's point, tricuspid, mitral. I'm also going to auscultate in this position. Sorry, you're getting that workout. Now we'll move on to the abdomen portion. I'm not going to uncover the patient. We're looking at this. I'm looking at skin again. I'm going to look at contour of the abdomen, make sure that it is symmetrical. I'm going to listen to our abdominal aorta, the renal arteries, the iliacs, and the femorals. I'm also going to auscultate vowel sounds in all 4 areas. Very good. Now I'm going to percuss. I have sounds of tympany and dullness over solid organs. Now I'm going to palpate the abdomen lightly. Now I'll palpate a little deeper, looking for any tenderness or masses. Now I'm going to find the liver and the spleen. Take a deep breath in. There's liver, spleen. You can sit it for me. Now I'm going to test for CVA tenderness. Turn that way. Perfect. Sorry. Any tenderness? Okay. This way. Now we're going to move on to the musculoskeletal portion. We'll do skin again. I'm looking at hands, wrist joints, knees, hips, toes, looking for tenderness, any redness, edema, swelling. I'm going to look here at your hands and start with this. I'm looking for capillary refill, radial pulses. Alright, now we'll do some range of motion. I'm going to do the fingers, flexion, extension, hyperextension, abduction, adduction, like this. And just some rotation. Right, flexion. Do your ulnar deviation, radial, do rotation. Okay. Now we'll do the elbow. Do flexion, extension, hyperextension. Shoulders, do flexion, extension, hyperextension, do internal rotation like this, and then external rotation, and then circumduction. Very good. Now I'll test strength. Squeeze my hands for me. Good. I'm going to do your bicep, push up against me. Okay, and tricep, push down against me. Very good. Now we'll do shoulder, Push me out. Okay, push me in. Very good. Now I want you to shrug against me. Good, and that's cranial nerve 11. Now we'll do a cerebellar test. I want you to touch your index finger to your thumb and go like this, and then reverse the order and go back. Very good. Now we'll do stereognosis. Close your eyes for me. Open your hand. I want you to tell me what I'm putting in your hand.
Pen.
Very good. That's stereognosis. Now we'll do graphesthesia. I want you to tell me what I'm writing in your hand.
A B.
Very good. Now I'm going to do more skin on the musculoskeletal. I'm looking at warmth, tenderness, edema, discoloration. I'm going to look at the hips and the knees. I'm going to do sensation. I want you to tell me if this is sharp or dull.
Sharp. Dull.
Yeah.
Sharp. Dull.
I'm going to do your vibratory sensation. Use your wrist. Feel that?
Mm-hmm.
Okay.
Yes.
Now we'll do medial malleolus.
Yeah. Yes.
Now we'll do some deep tendon reflexes, biceps, triceps, patellar, Achilles, and then the Babinski reflex. Now I'm going to look at toes, ankles, knees, hips, looking for any signs of like nodules, tenderness, swelling, discoloration, making sure everything's nice and symmetrical. Hips, knees, toes, ankles. I'm going to look at toes on the capillary refill. I'm going to test dorsalis pedis pulses. Dorsalis pedis, posterior tibial. We'll do the same range of motion stuff on your toes. If you can do flexion, extension, hyperextension, abduction, adduction. Now for your ankles, I want you to go down and dorsiflex, do plantar flex and go up towards me. Go inversion, exversion, and then rotation. You're good. I want you to push down on me. Push up. That's for strength. For our knees, push down and push up. Now strength on the hips. I want you to push out and push me in. Very good. Now we'll do range of motion of the hips. I'm going to have you stand up. And we're going to do flexion, extension, hyperextension, do internal rotation, external rotation. Knees, do flexion, extension, hyperextension. Now I'm going to have you turn, and I'm going to look at the scapula, bend over for me just a little bit. In the flexion position, I'm going to palpate and inspect the spine, looking for any abnormal curvature, signs of scoliosis, any tenderness or swelling, and just a little bit more. will do some cervical spine range of motion, do flexion, extension, hyperextension, lateral flexion, and then do rotation and go all the way around. Okay, I want you to close your eyes, hold your arms straight out, and that's going to be our negative Romberg test. Now if you'll start over there for me, open your eyes, and I want you to walk towards me. I'm going to assess gait, turn around and walk back, and I want you to do heel to toe. Very good. Now stand on one foot, and then see if you can hop. Very good. And then now do the other side. Very good. Awesome. You can be seated. I think that's everything. That's going to conclude our head to toe assessment. Thank you.
Thank you.